So what's getting in the way of care happening in the home today? Like I haven't gone through, I guess luckily, sort of that search for a caregiver and caretaker yet, but I think it's an experience we're all going to go through in our lives. What's making it hard today?
I mean, I think I like to start by just like backing up and even saying like, what is home care? And it means very different things to very different people. So, for example, like let's say you're a 45-year-old, right? And you're doing dialysis at home. That's a very different home care experience than if you're 97 and need someone to help you with your daily tasks, right?
Absolutely.
So really, home care is just any type of health service, medical or non-medical, that might be performed in your home setting. And I think that when we often think of home care, we just think of, older adults who need people with bathing, dressing, medication support, meals, but it far exceeds that, right? You talk there, you go into the realm of remote care monitoring, you go into the realm of, patient self-management tools, rehabilitation at home, recovery at home. Like these are all what we consider at Gotcare to be part of the home care umbrella. And part of the challenge of what we're, as you can imagine, just by this alone, is just expanding people's minds of what is the art of the possible. Because we're very it's like we've gotten accustomed to being able to order whatever we want around the world to our doorstep in 10 days or less.
Yeah.
But we haven't yet oriented ourselves on imagining what could be possible in healthcare.
Well, that is such. Okay, so that is such an interesting insight, right? Because when we talk about innovation, we often get wrapped up in change, and I want to talk to you about change because change is hard for people. It's hard for organizations. It's hard for incumbents. But there's this whole other thing of like outside inspiration. And to your point, like the art of the possible, we're used to on-demand services. How has that changed people's expectations and moved the needle of what is sufficient for those that are either seeking care or seeking care for others?
I mean, I think that given the access problems right now, people are not definitely thinking about it in that way. I think people are just wanting to access services in general.
Yeah. So there's this, I mean, so there's this massive gap, right?
Totally. It's more of just allowing ourselves to your point, be really inspired by what could be and thinking, well, how can I transform how I think about this, as well as my team and the other organizations and partners that I work with in collaboration to deliver a service, to collectively think about this differently. Because the challenge with systems change work these days is that all our systems are incredibly intermeshed. It's like you can't do one thing without another thing. And this idea of a single organization making a small change to change an ecosystem, especially in healthcare, I think is just like it's like a shiny thing that is very challenging to chase and might be true for very specific nuanced situations, but for the most part, it's collective change that needs to happen in order for your company or your team's innovation to see the light of day.
Well, you've definitely chosen an important space. I don't think any of our listeners would disagree with that, but I think most would also recognize a hard space to affect change for the reasons that you said, right? It's interconnected. There's multiple funders and players. There's all kinds of stuff going on. And it's both critical and also emotional. So like, there's just a lot going on here, but I do love this. I do love the idea that maybe there's some outside force, some maybe some tailwinds behind what you're trying to do in that gap between sort of the art of the possible, people knowing that there has to be a better way and their current experience, right? Yeah. Because if you don't know there's a better way, then you're maybe less frustrated. So what is the better way? What is Gotcare doing to help solve access to home care?
Yeah, so I think before I answer that, I just want to say that I think when we're looking for the intervention point, right, which is really what we're all looking for in our various different organizations and verticals, is it's like I like to think of it as like acupuncture. You know, it's like when you're getting acupuncture done, sure you could get a needle inserted anywhere, but there are specific points that
Sure.
really impact the whole body, right?
Yeah.
And so similarly, I like to think of it as like, well, what are the acupuncture points of the system? Essentially, what are some points that there's more collective agreement that this is a problem, this is like a really important problem, and that there's a almost like an ease or a willingness to look at how something can be done differently as a result of that. And so for us at Gotcare, I'll give you one example, is we're looking at how we can use home services that can be provided in the home setting as a way of addressing our ALC crisis. And for those who are not familiar, it's the alternative level of care beds, which basically means you got a bunch of people in hospitals, roughly about one, depending on where you are, roughly about 1 in 4. You got a
Wow.
bunch of people in hospitals that are occupying beds that don't need to be occupying beds, but they have nowhere else to go. It's
Mm-hmm.
so they're there because they have nowhere else to go. And so what we're looking to do is we're looking to say, okay, well, what percentage of those folks can we bring home through a bundled managed service? And so it's through that we're then, so it's not like we're solving for home care, right? We're not at all, not at all. We're solving for this issue in the hospital, but that the way we address it is in the home environment. And it just so happens that addressing in the home environment is more financially sustainable. It's often more comfortable for the client, all these other reasons as well. And it's again a bit of a departure and a bit of an expanded mindset of what we think when we think of home care.
Well, that's really fascinating. So do you think of the hospitals as kind of beneficiaries and stakeholders of your work, and obviously the medical system as a whole, because hospital beds are expensive, or are they a customer? Right? How because you've got a lot of moving parts. Who's your customer? Who's the person that you think
Yeah.
about first?
So at Gotcare, in terms of from a business standpoint, our business customers um, are funders of care. So
Yep.
we work with care funders, both private and public. So we work with actually a very large number of insurers across the country. But at the end of the day, the people that we're serving are the people who oversee that care from either a case manager standpoint or a care coordinator standpoint, as well as the people who are receiving the service. Because at the end of the day, all of the metrics that our care funders typically tend to care about tie back to those two audiences.